So teaching people that are diabetic, especially if they're type 1 diabetic, they need to learn to give themselves shots. So fear of needles. Um, they might be scared of injections. Eating habits. People really need to control their eating and watch what they eat and either just keep track of it by looking or counting the carbs or the points, whatever it is. They need to be compliant with their medications. And of course, a lot of them will say, well, I feel great, so why do I need to do this? Well, because the destruction is very slow and it comes on quietly, and before you know it, you'll have something, and it's irreversible. You can't reverse these problems like neuropathy or blindness or kidney disease. It could be an expense, can they buy the needles? Or can they pay for the needles? Can they pay for the injections? Um, so if they're skipping meals or eating extra, are they checking their glucose? Are they doing everything they need to be compliant? So myth or reality, diet foods are the best choice for diabetics, yes or no? So there's something that's not actually has nothing to do with diabetes. It has to do with an endocrine problem, but I put it in here because lots of people think it has to do with diabetes, but it's not. It's a syndrome of inappropriate antidiuretic hormone, or SIADH. So basically, your pituitary gland secretes ADH, which is an antidiuretic hormone. So if you have SIADH, you have too much antidiuretic hormone, which means you're holding on to fluid, you're not peeing enough out. So this is an issue that sometimes people say it looks like diabetes, but it's not. I just wanted to point that out, that that's a thing you'll hear about more next semester. So diabetes insipidus is the opposite. It's patients that are deficient in antidiuretic hormone. These patients are opposite. They are peeing out 5 to 20 liters of urine a day. So the misnomer is this, is the patient has diabetes insipidus. Well, if you actually have this and not type 1 diabetes that's undiagnosed, this is an endocrine problem. It's not a diabetes. Although remember, polyuria is one of the symptoms of type 1 diabetes if you've not regulated it. And so you would think, oh, well, you've got diabetes. Well, no, diabetes insipidus, wrong name here, is an endocrine problem for ADH. And here we go, Santa Claus died.